Hi, my name is Hannah Park and I teach and research at the University of Kansas. I'd like to present a study of how design thinking can be utilized for non-design education, such as medical education. I would also like to share that this is an interdisciplinary collaboration design project that I work with a team of my 5 graduate students, Maria, Denise, Kaitlyn, Arturo, and Shant from KU, and Dr. Blake Lesselroth, who is a physician and vice chair of medical informatics at the University of Oklahoma, and Jane, who is a medical student at OU. So just like people-centered design in our design industry, in the field of medicine, there are increasing demands in person-centered care. So person-centered care refers to the medical care that is respectful of the individual patient's preferences, needs, and values. And you know what is the common ingredients in both people-centered design and person-centered care? Well, they both require empathy. Patient-centered care or person-centered care requires clinicians to have empathy toward their patient as they need to perceive their patient not merely as a patient with illness, but as a person who has certain values, lifestyles, emotions, family, friends, career, and hobbies. Although medical school typically teach about empathy during the pre-clinical years, research has shown that empathy erodes during the clinical years. So in spring 2020, I teamed up with Dr. Lesselroth and challenged my graduate students to develop a collection of design thinking exercises for medical students. Specifically, through empathy building intervention, the project aims to enable the medical students to recognize their own biases, apply practicable skills to understand their patients' perspectives, and use the feedback to deliver context-sensitive care. Each student was required to design one design thinking exercise, and the final design deliverables include the executive summary of the proposed exercises, or the teaching materials, evaluation forms, and instruction guides. In order to develop design thinking exercise for medical students, my graduate students had to study 2 things first: design thinking and the existing medical education. We also did a role play exercise. So Dr. Lesselroth and Jane took the role of clinicians and my students took the roles of patients. And this role play exercise helped the team to learn the current way of clinician and patient interaction and inspire the idea of design thinking exercises that we later developed. Let's take a look at the outcomes. So I'd like to introduce 3 design thinking exercises from the works that my graduate students proposed. In the first concept, the facilitators split the medical students into multiple teams. Then the facilitator will give cards that contain patient feedback, such as what we see on the screen right now. And using those cards, each team make affinity diagrams based on the themes like building trust through relationship or cost of treatment and insurance. And after the affinity diagramming, the students write down ideas of how they would improve the overall patient care experience based on the themes the group choose. The second exercise involves a workbook that each medical students will fill out. The workbook first focused on the medical students' mental well-being. So the concept is basically based on the idea that when you are on the plane, that you need to buckle up yourself before you help others to buckle up. Then the workbook shows a patient persona and asks what type of questions the students would ask to the patient during their consultation. The third exercise asks the participants to pair up and interview each others. Then they create prototypes or draw like medical on-the-go bags for the particular person that they have interviewed with. The significance of this whole project is exploring the ways of how design education can be applicable to medical education to empower clinicians' empathy toward their patients. And after this project, Dr. Lesselroth and I co-ran an all-day design thinking workshop in May 2020. There were 48 medical students and physician assistant students from the University of Oklahoma. And some of the concepts that we got from this project inspired the workshop materials that we actually developed and used. And we are now currently writing journal articles based on the finding from the workshop. Thank you very much.